Do you know what psoriasis is? It's a chronic skin condition that affects millions of people around the globe. Imagine your skin cells multiplying up to 10 times faster than normal. This rapid turnover of cells results in scales and red patches that can be itchy and sometimes painful. Common symptoms include red patches of skin covered with thick silvery scales, small scaling spots, dry and cracked skin that may bleed, and itching, burning, or soreness. Psoriasis is highly prevalent, affecting people of all ages, races, and genders. It's important to note that despite its appearance, psoriasis is not contagious. You can't catch it from someone else, nor can you pass it on. It's a condition that comes from within, often triggered by factors like stress, infections, or certain medications. Psoriasis is a lifelong skin disorder that can significantly impact one's quality of life. Now, you might wonder, how does psoriasis affect individuals in their everyday lives? Well, let's dive into a real-life case. Let's call our subject Jane. Jane, like millions of others, lives with psoriasis. Jane's journey with psoriasis is not just about managing a skin condition. It's like a ripple effect, touching every aspect of her life. The physical discomfort of psoriasis is more than skin deep. Jane often experiences itching, burning, and soreness. Activities as simple as showering or getting dressed can become a painful ordeal. But psoriasis doesn't stop at causing physical discomfort. It's an emotional journey too. The unpredictability of flare-ups can lead to feelings of frustration and helplessness. Jane often finds herself worrying about the next outbreak, the next patch of red, scaly skin that might appear. This constant anxiety can cast a long shadow over her daily life, affecting her mood, her sleep, and even her relationships. Then, there's the social aspect. Our society, unfortunately, often judges people by their appearances. Jane, like many others with psoriasis, has had to face unwarranted stares, whispers, and even outright rejection. This social stigma can lead to feelings of isolation and loneliness. And let's not forget the mental health implications. Living with a chronic condition like psoriasis can significantly impact one's mental well-being. Studies suggest that individuals with psoriasis are more likely to experience depression and anxiety. Jane, too, has had her bouts with these conditions, adding another layer of complexity to her journey with psoriasis. Psoriasis, as we can see, is not just a skin disorder. It's a condition that can influence multiple facets of a person's life. It's a battle fought on many fronts, physical, emotional, and social. But remember, every battle also carries the potential for growth and resilience. Jane's story is not just one of struggle, but also one of strength. She's a testament to the human spirit's ability to adapt, endure, and overcome. As we can see, psoriasis can influence multiple aspects of a person's life, including their mental health. So what causes psoriasis and what could possibly trigger an outbreak, you may ask? Well, let's delve into it. Psoriasis, as we know, is a chronic skin condition with no current known cure. But what's behind its onset? It's a combination of two key factors: genetics and environment. Let's break it down a bit. Firstly, genetics. Psoriasis tends to run in families. This means if one or both of your parents have the condition, you're more likely to develop it too. But it's not a sure shot. Even with a genetic predisposition, not everyone will get psoriasis. This is where our second factor, the environment, comes into play. Now, environmental triggers vary greatly from person to person. They could be as common as stress or as specific as certain medications. Other triggers could include injuries to the skin, infections, or even changes in weather that dry out your skin. And for some, it could be certain foods or drinks that cause their psoriasis to flare up. Let's consider a real-life example. Meet Jane. Jane noticed her psoriasis first flared up during a particularly stressful period at work. Over time, she also identified that her symptoms worsened whenever she consumed alcohol or when she didn't get enough sleep. By recognizing these triggers, Jane was able to make lifestyle adjustments that helped manage her condition. And that's the key. Identifying triggers isn't just about understanding what causes an outbreak. It's about being proactive, making changes to avoid these triggers where possible. It's about taking control of the condition rather than letting it control you. Now, Everyone's journey with psoriasis is unique. What triggers an outbreak for one person might not affect another at all. That's why it's crucial to pay attention to your body, to notice what worsens your symptoms, and to discuss these observations with your healthcare provider. Remember, the journey to managing psoriasis starts with understanding it, and understanding it starts with identifying what triggers an outbreak for you. Identifying triggers is a crucial step in managing psoriasis. So let's take that step together, shall we? While there's no cure for psoriasis, there are ways to manage the symptoms. Let's delve into various treatment options available to manage this chronic skin condition. Firstly, topical treatments are often the go-to for mild to moderate psoriasis. These include creams, lotions, and ointments that are applied directly to the skin. They can help to reduce inflammation, slow the growth of skin cells, and soothe the skin. Some of these treatments can be obtained over the counter, while others may require a prescription. For more severe cases, light therapy can be considered. This involves exposing the skin to ultraviolet light under medical supervision. It's typically used when topical treatments are ineffective. Light therapy can be quite effective, but it does require regular sessions, and there's a risk of skin damage with prolonged use. Systemic medications, either oral or injectable, are usually reserved for severe psoriasis or psoriasis that's resistant to other treatments. These medications work throughout the body to suppress the immune system, slow the growth of skin cells, and reduce inflammation. Now, let's look at a real-life case study. Meet Jane. Jane has been battling severe psoriasis for over 10 years. For her, topical treatments and light therapy were not enough. She started on a systemic medication, and within a few months, her skin started to clear up. She's been able to maintain her skin condition with regular medication and checkups. But it's important to note that Jane's case isn't the norm for everyone. Psoriasis is a highly individual condition. What works for Jane may not work for someone else. Side effects, cost, lifestyle, and personal preferences are all factors that can influence the choice of treatment. It's crucial to work closely with your healthcare provider to find a treatment plan that suits you best. This might involve trying different treatments or a combination of treatments until you find what works for you. Remember, what works for one person may not work for another. It's about finding what works best for you. Living with psoriasis can be challenging, but it's not impossible. Consider the story of Emily, a vibrant woman in her 30s. When she was first diagnosed with psoriasis, Emily felt her world crumble. The constant itch, the flaky patches of skin, the stares from strangers. It was overwhelming. But Emily didn't let psoriasis define her. She discovered ways to manage her symptoms, like keeping her skin moisturized, avoiding triggers, and taking her prescribed medication. Today she works as a freelance graphic designer, creating stunning visuals that inspire others. Then there's Sam, a high school teacher with a passion for literature. Sam was diagnosed with psoriasis during his first year of teaching. He faced many days of discomfort and self-consciousness, but he never let it stop him from doing what he loved. He found solace in his books and poems, and even used his condition as a teaching tool, educating his students about psoriasis and fostering an environment of understanding and acceptance. And let's not forget about Ava, a marathon runner who refused to let psoriasis slow her down. When she developed plaques on her legs, she was initially embarrassed to wear shorts during her runs. But Ava realized her strength was greater than her skin condition. She continued her training, even running a marathon to raise awareness for psoriasis. Each of these individuals found their own strategies to cope with psoriasis, whether it was through medication, lifestyle changes, or simply maintaining a positive outlook. They refused to let psoriasis limit their potential or dampen their spirits. Their journeys are a testament to the resilience of the human spirit, and how adversity can often lead to strength. Remember, you're not alone in this journey. There are countless others facing the same challenges, and numerous resources available to help you navigate life with psoriasis. With the right support and treatment, people with psoriasis can lead fulfilling lives. So let's keep the conversation going, because awareness and understanding are the first steps towards living well with psoriasis. We hope this video has given you a better understanding of psoriasis. It's a condition that affects millions of people globally, yet it remains misunderstood by many. By sharing this video, you're not just sharing information, you're helping to dispel myths, eliminate stigma, and foster a more empathetic world for those living with psoriasis. Remember, knowledge has the power to change lives. It can lead to early detection, better treatment, and even prevention. So, take a moment to share this video with your friends, your family, your colleagues. Maybe you know someone who could benefit from this information, or perhaps you'll ignite a spark of curiosity in someone who'll go on to make a significant contribution in the field of psoriasis research. Every share, every like, every subscription brings us closer to a world where psoriasis is better understood and managed. Don't forget to like, share, and subscribe for more informative videos like this. Together we can make a difference.